From the nursing industry to the retail, when an Austin couple had trouble having their second child, they visited the fertility doctor, all to find out it wasn't covered by insurance. Renata and her daughter are making fresh squeezed orange juice.
Oh, great job. A little bit more.
Once 7:20 rolls around, Renata spends her morning making breakfast for her 5-year-old girl. Her husband, Vladimir, is already at work. They moved to the Austin area from Fresno, California.
Sometimes we do crafts about what we're learning.
After she drops off her daughter from school, it's either time to visit the fertility doctor or time to go to work.
Is old enough now to where she realizes that I'm not home on the weekend, so she always wants to know why she and Daddy are home and I'm not home.
While she once worked Monday through Friday, her schedule has changed along with her career. Spending years as a nurse, she eventually moved to the retail industry.
We just literally could not afford it. And then I started doing research and I wanted to see if there was any employer where I would be qualified to work, where I could possibly find some fertility benefits.
Renata and her husband were trying for baby number 2, but after several years, they decided to turn to a fertility doctor. She realized her health insurance as a nurse covered almost everything but fertility benefits.
Every time a couple comes in and I've got to explain to them, you know what, we've exhausted all of the reasonable possibilities, or you've got a condition that lends itself to a situation where your only real chance of having a baby successfully and easily is in vitro fertilization. And then I find out that they have health insurance that's not going to cover it, and they can't afford it.
Dr. Silverberg, Renata's fertility doctor at Texas Fertility Center in Austin, says although it's less common now, it still happens too often. Without insurance, Renata and her husband spent around $18,000 trying to have their second child, eventually leading her to her new career path.
You can't even compare what you'd pay insurance versus no insurance. And we did the no insurance for almost 2 years, and that it just added up.
Now being able to afford in vitro fertilization, a procedure to help with fertility, she has faith that baby number 2 will be coming soon.
She knows that I go to a fertility doctor, and if you ask her how mommy's gonna have a baby this time, she says that she'll tell you that the doctor's gonna put it there.
Something she's been longing to tell her daughter for years.